My name is Charlie Jose. I am a primary care provider at Peace Health. Colon cancer screening is something that we recommend for everybody at minimum starting at the age of 50, but recent guidelines have recommended that we start screening for colon cancer at the age of 45. We screen for colon cancer because after the age of 50 and beyond, one's chances of getting colon cancer goes higher and higher by the decade. And so we always want to make sure that we are catching any type of colon cancer before it becomes a big problem. Colon cancer screening is to look for colon cancer inside the colon. And the colon is a passageway after our stomach, also known as the large intestine, where we tend to store our poop before we get rid of poop in the toilet. So there's a few ways that we screen for colon cancer. The gold standard that we use is typically a colonoscopy, where we take a camera and we look inside the colon to see if there are any signs of precancerous growths. So that tends to be the major way that people get screened for colon cancer, is a colonoscopy every 5 to 10 years, depending on what we find. The other ways of screening for colon cancer would include things such as Cologuard or FitCard, and so those are basically stool sample cards that people take home every year. They collect their own poop sample, bring it to our lab, and our lab can identify whether or not there are signs of colon cancer. If someone does have a precancerous growth during their colonoscopy, we're able to just snip it off and take it off, send it to the lab, make sure that it's not growing anymore. If it is later colon cancer, we are still able to snip off some cancerous growths during the colonoscopy, but more often than not, if someone has progressed to the level of colon cancer, they're needing more aggressive interventions, such as a potential colon resection, where we take out the part that has cancer and pair that with even chemotherapy. If one does have a family history of colon cancer, we tend to think about screening a little bit sooner. Not necessarily that we're doing anything different, it's just we bump up the time for screening. So typically if someone has a family history of colon cancer, we're thinking about screening them 10 years before that particular family member was diagnosed. Smokers and drinkers tend to be in a unique group that might be at higher risk for colon cancer. Certain diets can play into the risk of colon cancer as well. With colonoscopies, a lot of people are very concerned about getting the procedure done because of what they've seen on TV or what they've heard from their family members. But what I could say is that colon cancer screening, the colonoscopy nowadays has come a long way. We no longer have to pursue a giant prep where you are chugging 2 liters of fluid to clean out your bowels. It's become much simpler than that. And so the process of getting into the hospital to prep for a colonoscopy and getting out of the hospital has been much, much easier for people. We have very skilled staff who are able to do colonoscopies here. And so absolutely anybody could get colon cancer screening done in Ketchikan.